the situation we have experienced here in Ontario and right across the world. The situation caused by COVID-19 is unlike anything we've seen before. We've had to do the unthinkable, close our economy, ask people to stay home, close schools, and so much more. Over 112 days have passed since the Premier declared a state of emergency in the province, and the end is in sight. But this wouldn't be possible without the support of the over 14 million people who call this province home, and I thank you for that. I'm pleased to see that the legislature continues to sit, and members are on this House to continue to work so that this is important to the people and our communities. During this time, we have all had to adapt. Businesses, government, and other sectors have had to change the way things have been done. And we all know how difficult change is, especially in government. But that's why this bill, put forward by the Minister of Health, is all about. That's what this bill put forward for our healthcare workers who want to deliver the best possible care to our patients. We've seen the dedication firsthand over the past few months, and as we have all said here in the legislature and back home in our communities, we are extremely grateful. When patients fall through the cracks in home and community care, it's not because of our healthcare workers, but rather because of the antiquated system and frameworks in which they must operate. The current legislation respecting home and community care is the Home Care and Community Services Act 1994. And while the legislation and delivery models it supports may have been effective 26 years ago, they do not meet the needs of patient care today. Specifically, the Act hasn't kept pace with the changing demographics and increasing client acuity, increasing opportunities for care at home, client preferences, innovation in technology and delivery, and changes in sector governance. It's time for legislation that keeps up with the changing times and enables the best possible care for our communities. And Ontarians deserve nothing less. One thing that's been brought up quite often in this House, and especially in many of my remarks, is this concept of silos in government and the broader public sector. And for those who may not be familiar, or perhaps we have some folks watching at home, the silo I'm talking about is exactly what comes to mind, a structure that is narrow, rigid, and top-down. Things don't flow from one silo to another, or if they do it, it's a slow and tedious process. I've seen it in healthcare, Speaker. Speaker, I was Vice Chair of the Board of Directors for Credit Valley Hospital in Mississauga. This budget can only be used for this. That department can only do that. This department won't talk to that department. That was 9 to 15 years ago. But these kinds of issues still exist today. But what baffled me most was when I saw it in government. Like many members who were elected to the Parliament for the first time, my first year especially was spent meeting with residents, businesses and stakeholders to hear their thoughts and ideas. And any time I met someone, I would ask, have you met with the previous government? And of course, many of them have. No shock there. But what was shocking was how many times some of these groups or people met with the government, and specifically with how many ministries. I met with Ministry Y, but they said it also involved Ministry X, so I should meet with them. I met with Ministry X, but they said it was actually more of Ministry Y, so I had to arrange a meeting with them, and so on and so forth. They wouldn't talk to each other. We have been working hard to change this in government, but the impacts aren't nearly as severe as they can be in the healthcare system. Under the current system, patients must interact with home care separately from primary care and hospital care. This can lead to appointment after appointment, assessment after assessment, even just to get an alternative care set up. Ontario health teams want to embed home care into other care settings so parents experience integrated home care and not patchwork. Care plans are currently rigid and restrictive. Any changes to care that patients seek must be authorized by a home care coordinator, and the care plans that will be approved have a set number of hours or visits with service maximums that really can curtail service. What we seek, along with Ontario health teams, is flexible care planning that is based on patient outcomes and care coordination that is closer to the front lines, and as responsive to patient needs as could be possible. The last thing that someone in need of care should have to do is navigate bureaucracy and administration just to make a simple request. Luckily, we have a plan. Alongside regulation, the Connecting People to Home and Community Care Act 2020, if passed, will allow us to improve the patient experience, enable a flexible delivery model, maintain continuity of care, help personal support workers, empower healthcare professionals, and take a concrete step towards ending hallway healthcare. Last year, more than 700,000 Ontarians received home care and 600,000 used community support services. Care at home frees up capacity in our hospitals, and especially now where patients really do prefer to be. This legislation will enable Ontario Health to fund home and community care services as an integrated health service through our Ontario Health teams. While the 1994 legislation doesn't keep up with changing needs, it's not necessarily broken. There are elements of the previous Act that we will be retaining, including the definition of home and community care services and their respective eligibility criteria, the requirement for an established complaints process, inclusion of home care in the jurisdiction of the patient's ombudsman, the ability to fund Indigenous organisations through the Ministry of Health and Long-Term Care Act, and the right to appeal certain decisions to the Health Services Appeal and Review Board. We are maintaining restrictions that limit the delivery of community services to non-profit corporations. And most importantly, we are preserving the existing approach with respect to client co-payments, where only community services can have co-payments. And if a patient is currently not making a co-payment, they will not pay a co-payment under the framework and legislation being proposed. Under the current system, healthcare workers often don't have access to the information that they require to provide appropriate care to our patients with varying needs. With privacy and control over your personal health care, especially the data, at the top of mind, patients who want it will have access to virtual care and more electronic communications with providers, making it easier to stay in touch. Care providers will be able to work as a team, enjoying better working conditions and providing better care. If the patient consents and the situation is clinically appropriate, home and community care services could be delivered virtually to support the monitoring of patients with chronic conditions, with a nurse checking in as needed. Nurses or therapists could also use video conferencing to work with personal support worker in the home to provide a more specialized care. And speaking of PSWs, the shift of home and community care to local integrated models will help us better use the resources we have and create conditions that may attract more people to the field. Prior to the pandemic, I had the opportunity to shadow a PSW one morning and see firsthand the work that they do. It is challenging, and the system to support them isn't what it needs to be. New models of care enabled by the legislation can improve working conditions for care providers like personal support workers by improving team-based decision-making closer to the patient. At the same time, our government is continuing to take steps to improve workforce capacity through improved scheduling practices and enhanced training opportunities. The legislation will also allow Ontario health teams to deliver more innovative models of home and community care. Patients will benefit from primary care, hospitals, home and community care and long-term care being able to work as a team to meet individuals' care needs. Ontario health teams will work together to understand a patient's full healthcare history and directly connect them to the different types of care that they need. My office hears regularly from constituents who have problems with health, long-term care and home community care services, like I'm sure many of this House have. People are facing delays in getting care because of bureaucracy, administration, multiple assessments, which over time become inconsistent, or alternatively, because the type of care that they have been receiving is no longer appropriate, and having been given steps or support as to how they can proceed. We want the OHTs to be a one-stop shop for patients and their families and be available 24/7 to support those in need of help. Again, these instances aren't people problems. My office has a very good relationship with organisations like our local Health Integration Network, or the LINs, who work to resolve issues to the best of their ability once brought to their attention. The problem lies within the current system as it is designed. We realise that these changes won't take place overnight, and we are absolutely committed to ensuring that home and community care services continue uninterrupted during the transitional period to Ontario health teams. Local health integration networks are being refocused into interim organisations called Home and Community Care Support Services, which will deliver home and community care and coordinate long-term care home placement. This is to ensure continuity of care and avoid the risk of service disruption that would result from changing employment relationships and service contracts with home care providers. The wind-down of the LINs is planned in a phased approach and will be done over time. During the transition, patients, their families and caregivers will continue to access home and community care services in the same way and use the same contacts. To reiterate, the passage of this legislation and the implementation of the framework it supports will have several positive impacts. It will make it easier for people to access home and community care in hospital, primary care and community settings. Hospitals, primary care settings and others will be able to arrange those home care directly for those patients instead of referring people to a separate home care organisation. Doing so will reduce burdensome administration and delays for patients. It will help provide people to connect their care providers through secure video conferencing and remote telemetric home monitoring devices. People with chronic conditions will be monitored at home, with a nurse checking in as needed. Nurses or therapists can use video conferencing to work with a personal support worker in the home to provide more specialized care when appropriate. It will provide more choice for people with high care needs to get care in new community settings. Patients will be discharged from hospital into a transitional care setting to gain strength and functionality to return home. And it will keep people healthier at home by empowering care teams to work together, enabling frontline care providers to make more decisions about care, integrating home care into primary care and acute care, and breaking barriers to access information to support this care will create teams that work together to support patients. No doubt, the past few months have shined a light in Ontario's healthcare system. It's more important now than ever that we continue to work to ensure that our healthcare system, our publicly funded healthcare system, that is and will remain the best in the world. This means looking at the system holistically and implementing changes while looking at results on a system-wide basis. Our government has already taken steps to increase capacity in our healthcare system, and this legislation would allow us to build on our progress while supporting individualized, effective, efficient and innovative alternative levels of care. We need to ensure our system keeps pace with the changing needs of Ontarians and take advantage of new technology, data and information sharing. Better ways of organizing the system will allow us to more effectively deliver the high quality and fully integrate care patients need and expect. The work was extremely important before COVID-19 hit, and it's even more important now as the virus gives us greater urgency to deliver better home and community care for Ontarians. While this work to transform from home and community care system continues, we will ensure that there is no interruption to services for those receiving them. Healthcare has always been a priority for this government, and in 2018, the Premier launched the Premier's Council on Improving Healthcare and Ending Hallway Medicine, chaired by Dr. Ruben Devlin, who sadly recently passed away. I offer my sincere condolences and sympathy to his family, especially during these already difficult times. Under his leadership, the Council released 2 reports outlining strategic priorities and actions that will lead to improved health and wellness outcomes for Ontarians, high patient satisfaction, and more efficient use of government investment using an effective delivery structure. The most recent report, released last June, outlined 10 recommendations to the government, and among them, put patients at the centre of their health care, ensuring they are well supported and treated with dignity. Improve patients' and providers' ability to navigate the health system. Support patients and providers at every step of their health care journey. Improve options for health care delivery, including increasing the availability and use of a variety of virtual care options, and provide better alternatives in the community for patients who require a flexible mix of healthcare and other supports, all of which the legislation before us today supports. This bill allows us to take an important step forward in addressing the inadequacies of our healthcare system and is the first of many steps. On behalf of my community of Mississauga-Streetsville, I wish to thank the Minister and the Parliamentary Assistant for their work and encourage everyone across this House to support this bill. And Speaker, I move that the question now be put. Thank you very much.